Okay, so today for our surgeries we have a cat spay booked in and a dog biopsy booked in. So just some biopsies removed from the lower back. So the schedule we'll be doing it in today is the cat spay first, as it's sterile. Then we'll move on to the dog surgery for the biopsies, and we'll start them at 11 o'clock today.
Yep, sounds good.
Okay, so for our cat spay and our dog biopsy today, we'll aim to pre-med them at 10:30, as we will need 30 minutes for the pre-medication to start working, and then that will give us enough time to set up surgery and everything for the cat spay if we want to start it at 11.
Yep.
Is that it?
Yep.
Cool. I'm going to be setting the surgery up for the cat spay. I'm now grabbing a sterile cat spay kit, grabbing a small hole, small drape for the cat, some supporting equipment to keep it in the right position for the vet. Now I'm grabbing some sterile gloves for the veterinarian to use throughout the surgery. I'm taking all the suture caps off the suture material. I'm grabbing a size 20 scalpel blade, that's what our vet prefers. And now I'm going to be connecting the ET tube to the anaesthetic machine. So by doing this, I'm disconnecting the oxygen line from the anaesthetic machine and connecting the T-piece line to it. I'm then removing the pink scavenger tube from the normal anaesthetic machine and connecting that to the T-piece. And I'm connecting all our monitoring equipment to the T-piece as well. Turning on the oxygen, making sure that's all working properly and we have some oxygen in the tank. Now I'm getting out all the tattooing equipment that we use, including a tattoo gun, some ink, and some cotton swabs and cotton balls. I am then getting some spray that the vet will use to spray in the cat's throat before she intubates it. I am now selecting ET tube sizes. I selected size 3, 3.5 and 4 as it is only a 4-month-old kitten and only weighs 2.4 kilos. Now I'm testing that this machine works by breathing into it, making sure the machine's working, that reads the heart rate and oxygen. I then had to take the scavenger tube onto the ET set as it kept falling out and wasn't fitting in correctly. Here we are starting the ovary hysterectomy surgery, so we prep the skin by clipping it and using chlorhex and iodine. I'm here checking the vital signs of the cat while it is under anaesthetic, and I'm going to tattoo the left ear once Paula has finished stitching up. Before she wakes up, she's injected with long-lasting pain relief and antibiotic injection. Here I'm monitoring her as she wakes up. Here I am washing the kit that we used on the cat spay, making sure all the blood is off the equipment. And now I am going to put it in the autoclave, ready for it to get sterile. Here I'm just cleaning up after the cat spay for our next surgery that we're going to have, so I disinfected the table, swept and mopped. Here I'm just cleaning the clippers. I'm getting all the blood, dirt, debris out of it by using a toothbrush, and then I'm going to go in with some chlorhex on a cotton tip to get in there where the toothbrush will not reach. And then once I'm done that, I will spray some toilet disinfectant on a swab and clean the clippers themselves. Okay, so little Winter went really well today with her cat spay. So I'm just going to tell you a couple of things about home care notes. If you don't remember it all, that's okay. You'll go home with a sheet of paper explaining everything we've done today and what you can and can't do when she gets home. So eating, just give her a little bit of food when you get home, half what she'll usually eat. Yep. Same with water. If she doesn't want to eat, don't pressure her, don't force her. But if she eats it and still seems a bit hungry, then you can offer her some more. If she hasn't eaten by 12 o'clock tomorrow, give us a call and we'll have to see her here in the vets, just because it can be a bit of a worry if they're not eating after surgery by the next day. Her sleepiness can last anywhere up to 12 to 24 hours. That's a common reaction from the anaesthetic she went under today. Exercise. So with a cat, it's going to be hard to keep her quiet as they like to jump and climb things. Yep. So the best option for you too is probably set up a little enclosure with kitty litter.
Yeah, I do have like a little cat carrier cage thing.
Yeah, with water, toys, and some food, possibly until the stitches are out.
Yep. So
do not let her go outside, and especially don't let them get dirty. So she'll be going home in e-collar as well.
Great.
Yeah. You can take it off her while she's eating and drinking and when you're watching her. But when you're not watching her, put it on her to stop her from licking and chewing at the stitches.
Yep.
As it can be a little bit irritating as it's healing.
Yep.
And make sure you have a look at the surgery site at least every second day just to see how it's healing. If you notice any redness, swelling, or irritation towards it, or even oozing, give us a call and we'll have to have a look at her. But the stitches will be ready to come out in 10 to 14 days. So just make an appointment with us now if you like, or you can call up as it gets closer.
Yep. Okay.
But yeah, that's everything. And she also has a tattoo in her left ear. There's a little bit of staining on the hair, but as she cleans around her face, that will come off itself.
Okay.
All right.
Awesome. Cool.
No gowns were used throughout this procedure of the cat spay.